You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers, today I'm chatting to Michael Yeo about RockPods and cupping in small animals. Michael is based in Melbourne, Australia. He is that vet rehabber that gets up, or should I say stays up, until 2 a.m. in the morning to make sure he attends a webinar live. He has been known to even do an all-nighter for the Vet Rehab Summit. Michael gives us some tips on how RockPods work, ways to get better connection, and different ways to apply them, as well as the type of cases which he has seen benefits in when he has been using them. Now, cupping is a technique often used in equine vet rehab field, but the length of dogs' hair, as well as the area to be able to treat, means we are slightly limited with dogs. Before we head over to that chat, if you've not already, please come and join us. We've got 4 amazing communities on Facebook. They are the Small Animal Vet Rehabbers, Hydro Vet Rehabbers, Equine Vet Rehabbers, and the Business Vet Rehabbers. This is where all the vet rehabbers hang out online, share research, tips, and advice. And it's a great, supportive community. We'd love to have you online there with us. If you're interested in doing some vet rehab specific online webinars, you can sign up to our free membership. We just uploaded them, new ones this month. You can go to onlinepethealth.com/free. Over to Michael. Hey, Michael, thank you so much for joining me.
Hi, Meg. Thank you for having me again. I appreciate your invitation.
For those of the listeners that haven't listened to our previous podcast, won't you tell them a little bit about yourself and how you got interested in RockPods?
So my name's Michael. Good evening or morning, or whatever time it is you're listening to this podcast. Yeah, I'm a bit of a multimodal rehabber. So I initially trained in myotherapy, and then that sort of took me into Bowen therapy and acupressure, laser conditioning. What else do I do? Kinesiotaping. And I'm also a vet nurse and currently trying to finish off my CCRP certification, as well as a couple of other bits and bobs of programs which I'm doing, just continuing education in conditioning and functional anatomy, things like that. So yeah, constantly learning. And I've been in the field for about 6 years now, sort of learning and sort of practicing since sort of 2019. Yeah, so I was doing, up until recently, I was doing some underwater treadmill as well, assistance there. But yeah, basically working with dogs, and I've worked with a few exotics as well. Cats, I guess, is the exotic for me, and a few lambs, and saw an odd possum once. So yeah. And I originally was an architect for 25 years prior to coming to the field of architecture. So I'm sort of a bit of a left field, but all of that training in architecture taught me about problem solving. So I feel that everything I'm doing really is just solving a problem. How to best sort the problems that might be there out, I guess. Yeah, sorry, a bit long-winded, but
No worries. So let's talk about the cupping. So how did you get interested in that?
Cupping, it's sort of going back as a kid. My dad used to get one of our neighbour friends to do acupuncture on him, and he used to do traditional Chinese medicine cupping with the glass cup and the herb, the moxa that they would use to heat the cup and place it on my dad's back. And Dad always had these little rings of circles on his back and sometimes on his front. I guess curious about them. But that would have been, when I was a kid, and I would have been probably 6, 7, 8 years old, sort of around that age. And then when it came to cupping, flipping over, a few decades on, I saw, actually it was one of your podcasts, one of your interviews with Diana Saskaran, who's an equine therapist and rehabber, and she worked with cups. And I had these RockPods, which I bought for myself for a few of my sporting injuries. And I just started playing around with my dogs, just seeing how they would respond to them with a bit of trial and error. And one of my dogs had wobblers, so I was using them on him as well. But yeah, it was more just sort of just experimenting and just using clinical reasoning with the concept of the RockPods for decompression to ease sort of muscle tightness and things like that. And it was sort of off the back of using a lot of rock tape. which I've also used a lot on me for my sporting injuries as well. And when I spoke to RockPod about them and what I was actually using them for, they gave me a bit of support, and I had to talk to one of the reps who actually lives around the corner from me here in Australia, about 5 minutes drive away. So we would talk about rock taping and RockPods. And from there, I just started trialing it on some patients of mine back in 2020, I think it was. 2020, might have been 2019, something like that. So I haven't been using them long, but I've had some luck with them, used with trial and error, but more success than not, because the patients for the most part have responded. So I just use it as an alternative to things like trigger points. Yeah, just muscle tightness when more traditional methods such as massage don't quite have the impact that I want it to. So it's just, okay, let's pull out another tool and see what we can do with that amongst all the other things that I do. Yeah, because sometimes bone therapy might not work, and so sometimes massage might not work, and the taping's not working. So I'll pull out the cups.
Yeah, it's great. So it's just another thing to add to our toolbox. So let's take a few steps back. Mm-hmm. So basically, the cups are the different types of cups that you can get, and what you want to do is you want to put those onto the animal person. So if even in humans. And you want to create a suction, and the suction actually lifts up the tissue. So it's great for those kind of tissues where we've got maybe a lot of muscle tension, maybe there's some scar tissue, adhesions. And it actually is basically, it's a little bit like, I suppose, the taping. It's just a different way of doing it. And those RockPods that you've got, so if you could just explain to us what they're made of, and then the different types of cups that are out there, because there are different ones. Like I've actually been, when you mentioned your dad, and I actually went for a massage once, and the massage therapist said, do you want me to do these cups? Your back is so tense. And I said, let's give it a go. Like I'm keen. And I did it. And I had 8 massive bruises, like hectic bruises on my back. And it completely freaked my kids out. They were like, what have you done to yourself? And, so I mean, obviously, it's very different how we're using them on animals. So we're using them more for like the mechanical effects. In animals, we don't want bruising, right?
No. Well, I mean, I've had cupping done on me, and this doesn't help on the podcast, but I mean, that was my back just the other day.
Yeah. So for those of you that are listening, Michael showed a picture with 2 huge purple circles on his back.
Yeah, just over my scapula, and then I've got another 8 of them. I kind of look like Thor in reverse with his traditional uniform on. But I mean, I've never aimed to try and get that same bruising or that you would see on a human. I mean, I guess if you look back at the Olympics, you think of Michael Phelps. That's probably one of the most famous photos of Michael Phelps in the swimming. I think I can't remember which Olympics it was, but I think it was 2016. But anyway,
he had those cupping circles.
Yeah, he had cupping circles all over his shoulders and over the scapula and everything, deltoids. So infraspinatus, supraspinatus muscles. So it can have quite a profound visual effect. I've never ever tried to do that on the patient because, and even rock tape themselves, when I've spoken to them, they don't recommend, even on humans, going to that extent with the RockPods. I've actually done podding on myself for my elbow tendonitis, and I can get moderate bruising, but nowhere near the same as we would with traditional Chinese cupping. So with a traditional Chinese cup, there's a few different types. There's a polycarbonate bell, for no better word, and then also traditional glass. They kind of look like stemless wine glasses, or just shorter or shot glasses. They can be different sizes. And with those, you get a fairly thin rim around that perimeter edge, which causes a compression on the skin. And then you get the decompression within that volume. And when they put heat in there to create that negative pressure, they use a moxa or they'll use a lighter to heat up the inside of the cup and then create a low pressure. It'd be a low pressure. Yeah. And then when they put that on the skin, it absorb the skin rises up, and basically you sort of, as a descriptor, you can delaminate sort of the skin layers, and you get sort of like not a blistering, but it looks like a blistering or a bubbling of the superficial skin layer. And then that draws up all the blood now, and then causes the bruising. RockPods can do the same thing, but nowhere near to the same degree of pressure difference between the rim or the edge of the pod and the void of the pod. The RockPods themselves are various sizes. They're sort of around about 55 millimeters and 65 millimeters diameter, and then there are two. That's one set of pods that you can buy, and then there's another set that I think are 75 and 85 millimeter diameter. And the pods have got a rim of about sort of 4 or 5 millimeters, because they're made out of silicon, actually, sort of to describe it. They're sort of bell-shaped, and then they've got like a little handle on the top, little round handle, like a button. Sort of like a mushroom on top of a cup is the best way to kind of describe it. And on the edge of the silicon pod, it's about 4 or 5 millimeters. So it creates a relatively large surface area compared to what you would have on a traditional cup. So that's sort of the difference between them. And then you can get different brands where they've got different types of silicon. Some are quite dense. Equine Cupping have got some cups, which some of them look similar to the RockPods, but then they've got some clear cups that are a much denser silicon. And I find those a bit more difficult to put on dogs because I can't get the same pressure. You have to push quite hard onto the bell to get that negative pressure. And I don't like pushing that hard, especially on a dog that might be sore or tense. But yeah, that's sort of the difference between the cups. And then there are also a whole bunch of new cups out on the market at the moment. There's other cups that include like red light lasers, or actually they're red light LEDs. I won't say laser, and they're built into the top of the pod, and then you can turn those on. There are other pods now that have got like vibration. So RockPod's got a pod that they sell in the US and in Europe that have a vibrating. So it's a silicon bell, and it's got a little battery operated vibration sort of component to the top part, and you can turn that on. Unfortunately, they're not going to introduce those here into Australia because the market's a bit small, but if I head over to the US or something, I might try and grab some just to trial, out of curiosity more than anything else. But yeah, the traditional Chinese medicine cups, they used to be made out of bamboo or horn. So that's sort of different again, or timber, which is what bamboo is anyway. And they would just use the hollow component of that. But modern day cups are generally made out of polycarbonate or glass, and then now silicon as well.
Can you talk us through the actual process of applying the pod then? So obviously you're talking now about the silicone ones. Mm-hmm. There are the glass ones. They're different types of ways in which you can attach them. Let's chat about how to attach the rock pod. So how would you prepare the animal, and how would you actually do it?
Yeah, with RockPods, normally, as I said, traditionally you would use heat to create the negative vacuum or negative pressure in the pod, or you can also use some of the polycarbonate pods. You use a decompressor, electric decompressor device, which will suck the air out to make the pod stick, and that's what you use on a lot of equine therapists use that type of traditional, or that method. With RockPods, there's three ways to get the pod. Three ways that I practice to get the pod to stick. One is that you just gently press down on the pod, and as you press down, you can hear the air sort of evacuate out of the void, and then the rim of the cup sort of grips onto the coat, and you get a bit of pressure, and that's a relatively light way to attach the pod. Well, that's actually the medium pressure to put on the pod. Another way to do it is to lift the bell, the edges of the bell up, and invert the pod, and then place it on the animal, and then you just sort of flick the edge of that rim, and it flicks back down onto the surface of the patient, and then it actually creates a firmer grip because of the pressure that's created within the bell. And then the third way to do it is to sort of just gently grab the edges of the pod and just sort of squeeze them together, place it on the patient, and then let go. Now, that's sort of the least invasive way to place the pod, but it's also, I haven't found it as effective as it works on people, on humans, because we're more or less hairless, but it doesn't work so well on hairy patients, generally speaking. But the disclaimer on that is that RockPods don't work well on long hair or medium hair coat dogs. You sort of have to stick to dogs like Weimaraners, Dalmatians, Vishlers, Great Danes, Boxers. They're sort of the more ideal coat. But the other thing to do to get the pod to stick is I've trialed using, the issue with RockPods and coats, dog coats, is that because of the air in between that sort of creates a insulation between the skin and the edge of the pod, you don't get a very good suction. So what I've tried in the past is I used to spray water with a spritzer on the dog's coat to just get some hydrophilic action between the surface of the edge of the rim and the coat and the skin. And that works, but not terribly well, because when the water sort of absorbs into the coat and the coat sort of starts to dry out, the pod just falls off. So what I've had my most success with is using ultrasound gel, and very liberally using ultrasound gel. And that creates a nice suction or vacuum within that void to help the edge of the pod stick to the coat. And it's fairly easy to wipe off and to keep clean because it's water soluble, to get the dog to get the pod to stick on the patient, the dog. I know in other cases, I know Anae Lloyd has used some ultrasound gel, and she's also used oils and infused them with whatever product that she wants to use in there to help as a herbal type of secondary herbal thing as well. And using the oil and that spray has helped for her to stick her pods onto horses, for instance. But generally speaking, I always use ultrasound gel. So I've just bought a big box of ultrasound gel and just make sure I've got 1 or 2 canisters with me all the time. And when I have the opportunity to pod a dog, I'll let the owner know what I'm doing, because I usually sort of get a bit surprised when I bring out the ultrasound gel and pod. So I have to explain to them what I'm doing with the pod and why I'm using it, and what the application is, and the cleanup method afterwards. And usually the owners are pretty happy to have the option on board. So ultrasound gel, and generally I do the inversion method to stick onto the patients, unless the patient's quite sore, and then I'll just use a gentle sort of push on plunger method over the top of the dog. Yeah.
Obviously, that seal is really important, because the seal is what actually causes that decompression. If you don't have a good seal, then you're not going to get that decompression. So when you've got long-haired dogs, have you ever shaved them in order to do it, or is that
no?
Just don't use that as one of your tools.
Yeah, I mean, it's the same with kinesio tape too. I mean, some of the dogs I work with are show dogs, so I'm not going to be shaving the dog just for the sake of trying to use a certain modality. If that's the case, I'll find another method. I mean, for instance, Laurie Ed Hughes has got another alternative method, which I've used as well, which is using a hair clip, which is
I saw that.
Similar.
It's really cool.
Yeah, a similar effect. So, it's just problem solving in a different way. And I have actually been using hair clips on a Aussie Shepherd recently. But the hair clips, in the same way that the pod causes a decompression and a negative sort of a pulling on the fascia and the myofascial tissue and separation of the skin and the muscle and fascia and everything in there. The clip works in the same way, because it's like if you put a hair clip on your head, you can feel a little bit of pressure, and that's basically what you feel. It feels very, very similar to what kinesio tape feels like. The difference with RockPods is it's a bit more of a direct pressure or inverted pressure or decompression. So it's a little bit more, I guess, obtrusive in some ways, but the dog patients that I've had have not ever complained about having it on them. So I don't shave the dog. Yeah, basically is the answer. Yeah, I'll find another method.
So for those of you that want to know about the hair clip, it's one of those large hair clips. They're about 10 centimeters long. They've got a whole lot of clasps on them, and then one sort of squeezy clip at the back. So it opens up looks like one of those, those plants that open their mouths out. What are they called?
Like a Venus flytrap.
Yeah, it looks like a Venus flytrap, and then it obviously attaches on. You mentioned previously about a new product that's coming out that is a vibrating one. And one of the things that I've noticed in watching people that are doing cupping is that they actually agitate and they move the pod. And I noticed when you had the clip, you were doing the same. You were circling it around. So how long do you leave the pods on? And are you agitating all of them, or is it just in some times that you would do that agitation?
Yeah. So the pods, I generally, like if I'm putting it, I'm generally putting on anywhere between 2 and 4 pods, or 2 and 8 pods, because 2 and 4 pods, because I've got 4 pods in my, actually, no, I've got 8 pods in my little container. So I generally use sort of 4 to 6 pods. And for me to apply all the pods sort of takes me around about sort of 2 to 3 minutes by the time I can get them all to stick. So that's sort of the treatment time, and then a little bit more. So up to 5 minutes is sort of what I've been doing. And that's what sort of RockPod recommend around about that time as well with the human patients. So in regard to the question that you were asking about whether I leave the pods on in a static or stationary position, which you can do, you can also use what they call as a glide technique. So what you do with the pod is that you can gently, with the little mushroom handle that's on top of the pod, you can gently either lift the pod, raise it up to create more decompression and separation. I'm not trying to pull it hard enough to pull the pod off. I'm just doing it to gently lift the skin. And then you can also do a glide technique, which is what Meg was just referring to then. And you can glide those pods craniocaudally, or you can do it laterally. So basically what we're doing, it's similar to what you would think of like doing a massage. If you think of one way of doing it, if you lift your skin on your forearm and you just gently lift it and then just gently traction it forwards and backwards and up and down and left and right, that's generally what it feels like. So I kind of think of it as doing massage in reverse. With massage, you're doing a positive pressure with your hand, but with the pods, you actually got the decompression. You're actually trying to separate all of that fascia and try to get that blood flow and lymphatic flow back in, and all the water back into the tissue to help with any adhesion, reduce the adhesion, and trigger points, things like that. So that, and then I would do that. I usually do it for about 10, 15 seconds, maybe 30 seconds. And I do it on the areas which might be more tight, for instance, on the body, or if there's a trigger point, I might just do a gentle oscillation of that. And you can gently rotate it too in your fingers as well. So you can do ventral dorsal, cranial caudal, lateral, and then also clockwise, anti-clockwise. And it's just massaging. It's just another way to massage, but you're using a sort of like a third party device to do some of that work for you. But the benefit of it is that you've got the decompression working in there as well, in addition to just the active movement that you're providing, or the gliding movement.
Michael, what area in the body do you find that you use them the most in your practice?
I tend to usually the lumbar sacral area, a little bit on the thoracic area. I have used them on larger dogs around over the scapula of the infraspinatus, supraspinatus muscles. You can do, on larger dogs, you can do sort of shoulder joint, and you can also do the stifles. It's a bit more difficult on small dogs because the pod diameter, or the circumference of the pod, is too big for to get a sound decompression over that area. So, and generally flatter surfaces. So the larger the area is flat, large flat areas work the best. So that's why I've only used them on the larger dogs for shoulders. Smaller dogs, I don't get much luck because you can't get the pod on there. I mean, I've got some other options I can use for smaller dogs. I can use kinesio tape and do a tab taping for that, and create like an inverted, or I fold the tape in half, stick the tape down onto the dog, and then I can gently pull on that tape, and it sort of works in a similar way, but without so much of the decompression factor, but you can do the same sliding motion with the tab taping over a dog. So that's another alternative. But again, I've got to think about what am I trying to achieve and the size of the patient. But generally speaking, large flat areas, surface areas work best. On horses, any size pod will work really, really well, but on dogs, it's a bit more problematic unless all your patients are Great Danes or something. But smaller dogs like Dachshunds, I've used the small pods on them, on their backs. Yeah, and I've usually done it around, like on IVDD patients. I've done a gentle pod on either side of the scar, and I've gently immobilized the skin just around the scar tissue. And I'll just do a gentle. So this is after the patient's the scar or the sutures have been removed 10, 14 days. And then I'll wait another 10 days or so for the tissue to fully heal. And then I'll go in and, you can do massage on there. You can also use the pods on either side of the scar, and you put them side by side next to each other, adjacent to where the sutures have been, scar line. And you can leave the pods on there, but generally I'll just do a gentle sliding motion, and you can actually slide the pods in opposing directions. So one's going up, the other one's going down, or caudal, cranial, cranial, caudal, to help reduce that scar tissue where the wound heal is, or where the wound is.
And how do your patients tolerate it? I mean, are most of them extremely tolerant of it? Have you had any that have really not liked it?
I haven't had any that jump or scream at me. Some of them will turn around and just look at me and wonder what's going on. But usually I won't generally do RockPods on the very first or second visit. Usually by the third visit, when the patient is, you've built up a rapport with them and a trust, they'll pretty much, let you do what they want with them. I've found. So I haven't had any that have complained. Yeah, it's usually the owner that's more confused than anything else about what's going on. And then, but when they can see the patient more, the mobility is returned, or, and there's less tension in the back, they're usually pretty happy, and the dog's pretty happy. So no complaints.
Awesome, Michael. It's been such an interesting chat. Thank you so much for giving up your time to chat about this topic. And I know that it's one that you're very passionate about, because in our groups, you're always giving advice and sharing all your knowledge about it. So I just wanted to say a quick thank you for everything that you do in our Facebook groups, to just those people that are interested in kinesiotaping and cupping. So thank you. Yeah,
I don't sort of distinguish the taping and the cupping as two separate modalities. I feel that they're very sort of closely aligned as a modality. You've just got different applications depending on your patient. But I do like it. I do enjoy it. I'm not the only one that does cupping. I know that there's at least half a dozen others that have sort of gotten on board with cupping. We've also used cupping, and I know Barbara Reiner has done some cupping as well in the underwater treadmill. So that works really well too, because she also uses, she's got the water there as well, but she does also use the ultrasound. But she places the pods on, on a static position. But by the dog walking in the treadmill, you're getting an effectively what they call an internal glide of the fascia tissue and all of the corresponding tissue around the area, as the dog's actually gating. So that's actually a really nice way. I know she's had success with that with some of her patients for lumbosacral issues. I know she had a Rottweiler that she did some work on and used the RockPods for that. So it's good here, that she's had some success as well in that respect. Yeah.
Awesome. Thanks for reminding us about that too. I'll try and see whether we can get another one of those photos of Barbara doing that in the group.
I might even have one, but ask Barbara for sure. If you can't get one, I'm sure she'll share it with everybody.
Yeah. Awesome. Yeah. Michael, thanks for your time. It's been absolutely amazing.
You're welcome. Thanks, Meg. All right. Have a good evening. Bye.
Bye-bye. If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 4th of November. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.